As a nurse, I've seen two people take the end of life medication, but both experiences were different. If you're unfamiliar with the Death with Dignity law, this is the law that's in 12 different states in the US that allows people with terminal illnesses with less than 6 months to live to take medication to hasten their own death or end their life. I'll put the list of each states in the description. Delaware is one of the newest states, making it the 12th state that allows this in the US. Now, I live and work in California, and California is one of the states that allows this. So I have witnessed people taking this end of life medication. I have two different stories with the same ending, but they did look different, and it was surprising to me. Two things I want to make clear are there is criteria to get this medication, and you usually are not on hospice before you get it. You have to get the medication before you come onto hospice because this is not a federal law, and hospice is funded usually by Medicare. So hospice will not provide the medication for you. You have to get the medication outside of hospice. Then you can come on to hospice when you want to take the medication. Another thing that surprises people is that healthcare professionals like myself who know about the medication and that it's legal in the state that I work in, I am not legally allowed to mention this as an option to someone that I am working with. I can only mention this is something that can happen if they say something to me or they ask me about it. Then I can offer them who they can talk to, how they can get the medication, that it's even available. But I'm not legally allowed to just say, hey, there's an option that you can do this. I have to hear them say something about wanting something like this or wishing there was something out there that they could take. And then I'm allowed to let them know of the law. I, as a hospice nurse, have chosen with my hospice company that I am okay with sitting with families and patients who want to take this medication. Now, because this is a controversial topic, even if it is legal in the state that you work in, you can always opt out of being involved. Doctors do not have to be involved. I have many hospice doctors that will not be involved in cases like this or will not order medications for patients who want it because they don't believe in this, right? The Death with Dignity law is a controversial law, and I'm sure many of you watching this don't believe in it either. So I want you to know that I respect what everyone believes in. I am okay with it. I believe that this is a right that people should have, but I would never push it on you or for anybody who doesn't believe in that. So as a nurse, I am one of the nurses in my company that does opt into allowing myself to be present to help families if they need support. But there are many nurses who are not involved in these cases. Now, that being said, I am not legally allowed to touch the medication, to do anything with the medication. All I am there to do is support. So I can observe, I can give other medications if the patient needs them, I can, support, answer questions. I'm basically just there as a safety net so everyone there can feel a little more safe. Now, no one needs to be there. There does not need to be a doctor present. There does not need to be a nurse present. So it just depends on what the patient and the family wants. And of course, you can get this medication and never take it. That happens all the time. People get the medication and they never actually take the medication. A lot of people just like having it as a safety net. So let's get to these stories and how they are so different and how it actually surprised me as well. So I never knew exactly how these medications worked. I thought you would drink medication and you would quickly die. I just assumed you would drink it and a few minutes later, maybe 10, 15 minutes later, you would die. And that has not been my experience. Or at least not in all the cases have that been my experience. The first patient I was with was a younger person, and they did have a terminal illness with less than 6 months to live, but they were very awake. They were very awake, they were very alert and oriented, they were walking around, and when I arrived at the house, I was kind of surprised, like, wow, he looks like he's doing pretty good. But after talking with him, he had been through a lot, and he had had a lot of pain, and he was not looking forward to losing more and more of his abilities. So he just wanted to take control and to end his own life when he chose. So he had his family there, he had his friends there. It was a house full of love and warmth and laughter. They were laughing and joking and watching movies. And I basically sat there as support until this person was ready. So before you take the medication, an hour before you take anti-nausea medicine to make sure you don't vomit the medication up once you take it. This is because the medication does taste really bad, so it can be hard to ingest. So The person took the anti-nausea medicine. An hour later, you have to mix the medication yourself. So it's a powdered medication of 4 different medications mixed together. So the person who is taking the medication has to mix it with, I want to say 3 to 6 ounces of fluid. They mix it together, and then you are told to drink it quickly. So you cannot just like kind of sip on it. You have to take it down. So because it tastes so bad, we usually tell the person to have some kind of like sorbet or something. Not usually ice cream, because dairy can mess with your stomach. So they usually have some kind of like candy to suck on, or like sorbet to take afterwards, because it does taste pretty bad. So this person takes the end of life medication. And of course, the family and the patient, to my surprise, were like joking all the way through, which was so amazing to witness how they can be so vulnerable and loving together, but then also still joke at the same time. And of course, he joked about how bad it tasted, and they were kind of carefreeingly saying like, bye, bye, you know, after he took this medicine. They all knew he would die soon after. And although it sounds maybe a little strange, it felt really nice. The whole environment felt really nice, really loving, and really carefree. It was such a beautiful thing. And to my surprise, because this is the first time I had watched this, remember, the person went unconscious very quickly. So he drank this medicine, right? A couple jokes about how bad it was. Everyone said their goodbyes, hugs, kisses. And I would say within 7 minutes, he was fully unconscious. And not just like kind of sleeping like they show in the movies where someone's like resting and it looks like they're just sleeping. No, he went from like fully awake to looking like he was actively dying within 5 to 7 minutes. And actively dying looks very specific. So their color changes, their mouth will hang open, their eyes will be open. He almost looked like he drank it and then died within 5 minutes. Like, it took me a second to think. I was looking at him thinking, wow, that was quick. Did he already die? And as I was watching, and everyone was kind of watching, because he did look different. He looked like he may have died. All of a sudden, he breathed. It startled everyone, because all of a sudden he was like looking like he was dead, and then he took a breath. Now, he was still very unconscious at that time, so eyes were open, mouth open, but he started the end of life breathing. So when he was not breathing, and then took that breath, and then started end of life breathing. So still not awake, very unconscious, very comfortable looking. But to my surprise, he went from like awake, drank the medicine, unconscious, actively dying very quickly. But then he actively died, meaning fully unconscious, changes in breathing. He had the death rattle. He had all the signs and symptoms of someone actively dying. But for about 45 minutes. For 45 minutes, we were with him and the family was with him, and it took his body basically 45 minutes probably to process the medication. And then eventually he took his last breath about 45 minutes later. So that was my first experience with someone taking the end of life medication. And it was very peaceful. It was very beautiful. But I suppose it felt surprising to me because, one, I was surprised by how quickly this person went unconscious. It was very quick. And then I was surprised by how long it took the body to process the medication and to die. And that he actually still had a very prominent actively dying phase like anyone would who was dying.
Hey guys, we're gonna get back to the video in 1 second, but I just want to let you know that there are more resources out there for you. I have a book, I have a workbook, and I have an online class. All of those things will be in the description, so if you want more help, it's there for you. Okay, back to the video. Bye.
I left there that day feeling honored that this person and the family would allow me to be there, to be supportive and to help the family. And I was proud to live in a state that allowed people to do this if they chose to have autonomy over their body. And I left there obviously feeling sad. It's a strange thing to witness, to see someone so full of life drink medication and then be gone. And even though I believe in it, it still hits you. It still feels hard. It still feels shocking. You know, so it was a profound experience for me. And I will always choose to opt in to be a supportive person there for families and patients. It's a scary time. And if I can be someone to help them feel less afraid, you know, while I was there that day, family was concerned, right? You know, I was the hospice nurse who never even witnessed this before. And I wouldn't say I was concerned, but I was surprised by how it went. So imagine being someone who was not used to seeing all of it, it still was a little shocking. I had to say, this is very normal. This is okay. He's breathing like this because of this reason. It's okay that it's taking 45 minutes. This is normal, which I've learned now that it's normal. And I was like prepped before I went to know what is not normal, what is normal. So it was an honor to be there, even though it was hard. Now, the second time I witnessed this is where it was so surprising to me about how different two things can be. The second time I did this, it was with a very elderly person. They were in their 100s. And when I went to see this patient, again, very lively, even more lively than the younger person that I saw earlier that year. This person was in their hundreds. They were walking around fully alert and oriented. His children were with him, who were also elderly. They were both in their early 80s. And I sat with him, and he was very certain about what he wanted. He was like, listen, I retired at 60. My wife and I traveled the world till we were 80. Then she died when he was around 85. And then he still lived almost like another 20 years. He was like, I'm good. Like, I'm okay with this. He eventually got metastatic cancer and eventually met criteria to take the end of life medication. When I went there to be with him and the family that day, he was ready. Now, his kids were a little not ready. They understood, but they were like, oh, it's all, they knew they would lose their dad that day, but he was ready. And he had it all planned out. He was excited. Like, he answered the door happy. Hey, like happy on this day. They decided to have me out of the room. So I wasn't in the room when he wanted to do it. And him and his kids were in the room. And they started looking through his wedding photo album because he believed that he would do this and then get to see his wife who had died years earlier. So they did that. He drank the medication on his own. The daughter did tell me like, hey, he's going to take it now, just so I knew. And he drank the medication, and then she came out about 5 minutes later to say he had died. And I thought to myself, well, that's too quick. That's probably not what happened. It's probably like the other time I saw this where they think they died, but really they haven't actually died yet, and he's going to start actively dying soon. So I go, oh, okay, let me just go check. And I go into the room, and I'm watching, kind of waiting for him to do the whole again and start actively dying. But he never did. He actually did just drink this drink and die that quickly. I don't even know how that could happen, really, because it takes time for medications to digest in the stomach, right? So it doesn't actually make any logical sense. But I'm telling you, 5 to 7 minutes after drinking that medication, he was gone. I had to listen to his heartbeat for 2 minutes, no breath, no heartbeat for 2 minutes. And that is how quickly it happened for him. So again, that was my second experience. And I think it had a lot to do with, one, I think his age. That was the big thing, I think. His age, and maybe the fact that he was so ready. Some of these things that happen at the end of life almost feel mystical, almost feel, unexplainable. But I can say it was very peaceful. He was very happy to go. His kids felt relieved that he was relieved. And it was a beautiful experience. I was a little less sad for him because he was so ready, and he had such a belief that he was going to be dying and seeing his wife that he missed very much. He died looking at his wedding album. So I didn't leave there quite sad, but it's still a profound thing to see life and see death all in one experience so very quickly, right? So again, such a profound experience, so honored to be someone who can be there for the families in two very different experiences despite taking the same medication. Oh, I love you if you're seeing this, because that means you stuck around to the end of the video. You are the real ones over here, okay? I know this video is a little controversial. It can make some people mad. Let me know what you think about it. And side note, have you guys seen Weapons? If you have, put Aunt Gladys in the comments. Guess who's being her for Halloween?